Metformin is an anti-diabetic drug, belongs to biguanide class. Here you should remember that metformin is the only drug available in this class. One more drug was available previously called fenformin. However, it was discontinued because of the strong association with lactic acidosis. Now the side effect we need to worry about is lactic acidosis. It more commonly occurs in renal failure patients as it is excreted unchanged in urine. So in renal failure patient, the excretion of metformin is decreased and its level increases in blood. As we have discussed that the primary action of metformin is to block the hepatic gluconeogenesis. Now the main substrate for gluconeogenesis is lactate, glycerol and alanine, which are converted to glucose in the liver. So increased metformin level in blood in renal failure impaired the hepatic utilization of lactic acid. That increases the level of lactic acid in blood, which eventually leads to lactic acidosis. Other conditions which increases the chances of lactic acidosis like severe respiratory disease, liver disease, congestive heart failure and chronic alcohol abuse. Metformin is also contraindicated in those conditions. Now there are mainly two types of lactic acidosis according to Kohinoot's classification, type A and type B. Type A is due to decreased tissue oxygenation, which is primarily due to decreased blood flow. Type A lactic acidosis is seen in hypotension, cardiac failure, cardiac arrest and septic shock. Type B lactic acidosis is due to some underlying diseases like diabetes mellitus, toxicity of medication, liver failure, malignancy and inborn error of metabolism. Metformin-associated lactic acidosis can occur acutely in an overdose, but typically has a more gradual onset in patients with hepatic or renal dysfunction due to decreased excretion. It often presents with nausea, abdominal pain, tachycardia, hypotension, and tachypnea. The lactic acidosis from metformin is primarily type B. But you should remember, in an overdose, the lactic acidosis can be compounded by type A when the drug's lactic acid accumulation leads to cardiovascular collapse, tissue hypoperfusion, and hepatic dysfunction. Hemodialysis is the definitive treatment for metformin toxicity, as 90% of the drug is eliminated via kidney.